There's a 2-year-old female tiger from Southwood Zoo, and they need to have her sterilized. And so basically we're going to laparoscopically remove both of her ovaries. My understanding, and actually I'm hearing most of this from the zoo, is that especially the white Bengal tigers are genetically unable or poor in the environment to breed. So they actually don't want white tigers reproducing. The main challenge, I think, is really the manipulations to get the tiger from enclosure in the zoo to us here at Tufts, onto the table, back, and back to the zoo without waking up or having problems. We will make 2 actually small incisions, maybe 1 centimeter incisions, and we'll do the whole procedure on a video monitor with a telescope and small instruments, and hopefully be able to get her back to the zoo quickly with small little incisions that don't need suture, that they can pretty much wake her up and let her go. Laparoscopy, there's very little access right now in New England, so we're one of the first doing that. Anyone that's had laparoscopic surgery is very aware of how little pain they have compared to an open procedure. So we see that as part of our role, is to decrease pain after surgery, and procedures that we can do laparoscopically will be awesome for the pet, awesome to the owner, and so good for everybody.
I think the challenges are primarily in administering the right amount of drug. So there's no way for us to get them on a scale before we dose them. So we have to guesstimate their body weight, and then we administer drugs that we hope are going to go into a muscle. If those drugs inadvertently go into a vein, you'll get a much more profound effect. And if we use an overdose, I've seen animals actually die after the injection of the dart. And I've seen some animals that think it's just irritating that the dart is there, and they fight it the whole way. And it'll take you sometimes up to an hour, hour and a half to actually get an animal if you underdose them to start with. So you're really working in a narrow range between effective and ineffective, or between overdose and ineffective. You have to really hit that prime number. And they usually send women home with non-steroidal anti-inflammatory drugs such as ibuprofen or Tylenol, and they try to discourage you from taking a lot of opiates. And in this case, we didn't actually give her opiates. We relied upon drugs that also provide sedation. They're called alpha-2 inhibitors. So they're very effective analgesics. So that was our intraoperative analgesia. We sent her home with a drug called meloxicam, which is a drug that we would give dogs and cats as well as tigers and cats.
As you can see, Taj, our white Bengal tiger, this is 2 days post-surgery, is doing really well. It's like she didn't even have the surgery. And I just want to thank everybody at Tufts. They did a great job, Dr. McCarthy. Doing a laparoscopic surgery like this on these animals is just, it's new, and it's a way to do this procedure. They have much less pain. You don't have to have an incision, and they just recover so much quicker. The next day, actually, she was even jumping around. So we were just happy that Tufts could do the surgery, and everything worked out well. And she's, like I say, she's recovered fully.